Dr. Jessica London. Welcome to the show.
Yes, thank you so much for having me, Lisa.
I'm really excited about this conversation, especially since I heard your presentation at the Real Coaches Summit a couple of months ago. So I'm looking forward to talking about all things pelvic floor health and rehab and strength training. Before we get into the nitty-gritty, though, I would love to hear from you. What's the number one thing that you are excited for our listeners to learn from this conversation today?
Yeah, absolutely. I'm excited for them to learn a little bit more about what the pelvic floor is and how to spot any pelvic floor dysfunction and what to do about it if they do notice that they're currently living with or struggling with any pelvic floor dysfunction.
Awesome. I think that's a great aim to have for this conversation, especially since sometimes we might not even think that what we're experiencing is related to pelvic floor health or lack thereof, so to speak. And I think even, men listening or people that are like, well, this, I don't think this affects me, it will benefit from just knowing more about the anatomy and so on. But yet, tell us how you even got into pelvic floor physiotherapy and what made you passionate about this.
Yeah, I love sharing this story because it's not like out of the gate. I wanted to work on pelvic floors or had a strong passion right away. To be honest with you, I started off in orthopedics, more orthopedics rehab. So this is sort of like weekend warriors, back, knees, shoulder injuries, and post-operative operation, like knee surgeries or shoulder surgeries. And I worked in that field and was a director of that clinic for about 3 or 4 years before I made the pivot to public health. So my foundation is really deeply rooted in orthopedics, rehab, and strength training. And then it was actually, the birth of my first son that landed me to have my first major surgery, which was my C-section. That was very unplanned and unexpected, but that was really when I noticed the massive gap in care for women and mothers specifically, not only in the postpartum rehab space, but also just pure education of what to be on the lookout for and how to support our bodies, as women and then at pregnancy and postpartum. Of course, pelvic floors are not only special for women, everyone has a pelvic floor. But for me specifically, that's when I really made the pivot to raising the standard of care and raising the standard of education for pelvic floor rehab, pregnancy, birth prep, postpartum recovery, and then how to return to strength training after you have babies. So that's really what my specialize in.
I love it. I love it, especially since most of the listeners here are also passionate about strength training, and many or maybe some might have experienced leakage during running or, issues with pelvic floor during lifting as well. So I think that's going to be a really great point for us to touch on later on. But to start off with, what is the pelvic floor? I think we often hear about it and we're like, okay, I know it's somewhere down there in the ab area-ish, maybe, but can you give us a little bit more of an idea where it is, what it is, when it does?
Yes, I think it's important to also associate ourselves to where the heck the pelvic floor is. It's often not talked about. And so a lot of people think, oh, I have a pelvic floor. I didn't even know that, right? So the pelvic floor is a group of muscles, connective tissue, ligaments, it has nerve supply, blood supply, all of those things. And it's located at the bottom of our pelvis, right? So if you're sitting, you can kind of rock side to side and feel those two sit bones, those two bony landmarks at the bottom of your pelvis. And the pelvic floor really spans from the front of your pubic bone all the way back to your tailbone and between those two sit bones, if you were to rock, side to side, almost like a diamond shape between there. So it really is the floor or the foundation of our entire body and our core canister system. So the pelvic floor really is that foundational piece for our bodies. It's a muscle just like any other muscle in the body. So it responds to muscular training and endurance and speed and strength and all of those things just like any other muscle would. But it's also innervated quite differently. So it also is more autonomic and it has functions that are working for us without us even thinking, just kind of like how we're breathing and we're not actively thinking about those things. The pelvic floor has functions like that too, to keep us from peeing our pants and, having pelvic floor related concerns.
Okay, awesome. That painted a good picture. I think everyone can kind of like, okay, here's this bone, there's that bone, and just what it's all involved in. But it completely makes sense that even when we cough, we walk, we might take a little jump or something like that, that needs to hold in all the organs and just sort of support everything else that's in there. So it makes a lot of sense. And I would like to kind of like shift into what might be some signs or symptoms of how we could spot dysfunction then in that area.
Yeah, so there's five major functions of the pelvic floor. And so we can spot dysfunction by knowing that these five functions are not working, right? So one of the main functions of the pelvic floor is sexual, and this is for intimacy, right? We conceive babies here. We also, the pelvic floor passively lengthens and opens for penetration, and it rhythmically contracts for orgasm for women specifically. So we can spot dysfunction if there's any pain with intimacy, if there is pain or difficulty to achieve orgasm. We can think of any dysfunction that populates in that more sexual piece. There's also sphincteric, right? So this is the second function of the pelvic floor. This is where we really help those little sphincter muscles, those little circular muscles in the pelvic floor. There's one around the urethra where bladder and urine flow. There's one around the vaginal canal, which is more like a muscular tube. And then there's also one around the anal canal as well. So these sphincter muscles actually stay on low grade constriction all of the time to prevent any leakage from happening in any of those directions. So dysfunction in that area looks like unwanted bladder leakage. This can be with coughing, sneezing, exercise, jumping, weight training. This can look like frequency or a high urge where you feel like you have to go to the bathroom and you can't control the urge. You just need to rush and go there right away. Or feeling like you're going to the bathroom every 20, 30 minutes to an hour, just on repeat, feeling like you need to go all of the time, but then when you get there, the bladder's not actually full and needing to be emptied. So we see a lot of people struggle with what they feel like are chronic UTI symptoms or UTI-like symptoms. That is not actually bacterial infection. It is more of a pelvic floor just being more in that dysfunction state. Other functions of the pelvic floor too are like support and stability, right? So we talk about the pelvic floor as the foundation for the house, right? And so it's the foundation of the pelvis. It is the ground level of the core canister system that works really closely with the diaphragm and the transverse abdominis and the rib cage. And when we see dysfunction in this that's present, we tend to see pelvic organ prolapse. So whether it's the bladder, the uterus, the rectum, feeling more of a fullness or a heaviness or a dragging sensation at the pelvic floor, the vaginal canal opening, or even like the surrounding structures, right? So hips, backs, groin, pubic symphysis, all of these areas can also be affected when there's dysfunction at the pelvic floor as well. And really, the last function of the pelvic floor is the circulatory system. So it's kind of the sump pump of the body, is the lower extremity pump for us to be able to circulate lymphatic and blood flow back up to the heart and the lungs and to continue to recirculate. So the pelvic floor is an incredible circulatory system when it's working well. When it's not working well, we run into things like pelvic congestion syndrome or just a lot of heaviness in that pelvic floor as well.
Wow, yeah, so many functions, so many possible dysfunctions, unfortunately, as well. And I think it's really interesting, like even to the point of circulation and stuff, things that we don't necessarily, or I don't necessarily associate with pelvic floor issues. Um, okay, so I'd love to walk a bit through various scenarios in terms of dysfunction. And as I mentioned, many or most of the listeners love some form of physical activity, whether it's cardio, whether it's strength training. And so if someone is having a little bit pelvic floor issues in the sense of, let's say, leakage or just in general, like issues with lifting that might be able to be traced back to pelvic floor issues, how do we go about rehabbing that?
Yeah, this is a great question. And honestly, I'm going to give you kind of a great answer because it's so specific to each individual person on why that dysfunction might be present for that particular person, right? So I wish there was like one blanket exercise or one specific movement pattern that we could all do, and then all of our dysfunction would go away. But what we tend to find is it's really important first to understand like the state of the pelvic floor, right? Is the pelvic floor too tight and too tense, which is more called hypertonicity? Is the pelvic floor too open and too elongated and too loose? And is that what's causing the pelvic floor dysfunction, like the leakage or the heaviness that we might be talking about with weightlifting or running? What's really important is we get down to that root cause of why that person is experiencing pelvic floor dysfunction. That's obviously what working with a professional will do for you. And then take it from there, right? Because some people are going to need more pelvic floor contractions and endurance hold and all of those things. And another person could listen to that advice and hear that, and it totally exacerbates their symptoms and makes their leakage way worse and their pelvic pain way worse and their pain with intimacy way worse. So I think that there's not a clear distinction of like what exactly somebody should do next. But what I can say is to be educated, right? So like get to know where your pelvic floor is located. I told you it's between the pubic bone, the tailbone, the sit bones. Like feel around down there, get acquainted to that area. Well, the pelvic floor should, in an optimal, pelvic floor position, it should optimally elongate and contract, right? So it should have mobility in both directions. So just like any injury or any dysfunction in the body, we first want to look at mobility first to make sure that there's not any restrictions present before we start loading and strengthening. So the pelvic floor is similar in that same aspect of get educated, get spatially, somatically, energetically connected to your pelvic floor. A lot of times people just go offline and they don't think about that area, especially if there's been past trauma, and we just disassociate from that. And so our mind-body connection is really distorted. So step one is just getting connected, right? Figure out where the pelvic floor is located. Start, feeling into that. When you take big breaths in, feel to see if the pelvic floor lengthens and opens for you. And when you exhale, does it gently lift up and kind of recoil? And just start getting connected to that pelvic floor again. And then from there, really understanding like why you might be dealing with those issues will give you better guidance of, okay, what's the next step after we've regained full range of motion in the pelvic floor?
Awesome. Yeah. And I mean, as so often, like even when it comes to nutrition or other things, the answer is it depends. And we do need an individualized approach. So I'm very grateful for individuals like yourself who provide this individualized approach. Nonetheless, I am gonna like nail you down a little bit. So if someone has a hyperactive, so too overactive, I guess, pelvic floor, what would be some quote unquote exercises more for that person versus that the person with the hypoactive inact or underactive pelvic floor.
Yeah, absolutely. So if we're thinking of someone with hypertonicity, this is where the muscles are kind of really guarded, really tight, really tense, really constricted. We want to work more on elongation and lengthening at the pelvic floor with this person. So really staying away from Kegels, staying away from long endurance holds, Pilates work, and a lot of these really deep core exercises. Someone who is dealing with hypertonicity might also experience things like pelvic pain or pain with intimacy, tailbone pain, deep hip pain, adductor discomfort. So those are other common symptoms and signs and symptoms of hypertonicity to kind of get an idea of like, maybe that's me, maybe I struggle with that. Yeah, you want to stay away from like really a lot of deep core work and deep pelvic floor work. You actually really need the opposite. And so oftentimes this also needs to be integrated into a nervous system approach because nerves interact with muscles, right? Like muscles aren't over here moving themselves without the nerve integration. And so typically what we're finding is the reason that somebody is hypertonic, that's not the root cause. Hypertonicity is sort of like the symptom. So we want to ask like why are they hypertonic? Why is their nervous system in overdrive that's constantly causing their body to be hypertonic. And what we find working one-on-one with our clients, there's a multitude of reasons. It could be birth trauma, it could be past trauma, sexual trauma, whatever it might be. It could be chronic lifting. It could be chronic, especially in your line of work too. We see a lot of bodybuilders struggle with hypertonicity, a lot of ballet dancers, gymnasts, anyone who has had to do a ton of strength training and contraction over a long period of time. We tend to see more hypertonicity present with this community. So it's about getting the nervous system to calm down a little bit. And we can do that through somatic practices, mind-body connection, and really getting more connected to the release, the lengthening, and the constant gripping that is going on at the pelvic floor to learn how to consciously be aware of that and start to release and lengthen.
Okay, awesome. Yeah, that makes a lot of sense, Jessica. And I like again that you're looking at it if from a wide lens perspective in the sense of it's not just what we see at surface level, but it might just be someone who's super type A with all things in life, never really letting go, control freak type of thing. And I put my hand up for previously being that or being a recovering sort of recall control freak. Okay, cool. So, and now on the other end of the spectrum, when it comes to the underactive pelvic floor, what sort of exercises do we have there?
Yeah, so for there, we're trying to gain awareness, contraction. We're trying to bring blood flow to the area. We're trying to bring nervous system integration to the area. So this is kind of a group where they feel like I don't even know where my pelvic floor is at. Like I can't even connect to that area, or like, am I contracting? Am I not contracting? So it's really bringing a ton of neural awareness, which is like that somatic, energetic mind-body control practice first, and then starting to build strength. This can look like, the pelvic floor and the deep core system co-contracting. This can look like getting a good, a longer contraction potentially. This can also look like prescribing this person to have more intimacy and orgasms because that brings blood flow and nervous system activation to rhythmically contract the pelvic floor. It can look like a lot of different things. But someone who is like hypoactive, they really lack good blood flow circulation, good contraction ability, and they have poor like neural motor control at the pelvic floor as well.
Okay, cool. And I guess because you mentioned intimacy there, so one big thing that you touched on in your presentation was that many women, and maybe you don't even speak about that often enough, experience pain while being intimate or are having issues while being intimate. And maybe you can go over some of the most common ones there, and again, sort of why and how to handle those.
Yeah, that's a great question. And so this can happen, whether you're pregnant or postpartum or have never had conceived or had a baby, right? So the pelvic floor does not discriminate to any particular group of individuals. We've often worked with clients that have had pain with intimacy their entire life from the first moment that they were intimate, and we're getting them 10 years later and they just thought it was normal. And it's so sad and unfortunate, and in 6 months we can really like solve it. So it's so sad that people live with it for that long. So just know that there's help and hope for you if you are struggling with that, okay? And with pain with intimacy, it really is a couple different things that could be causing it. So we tend to see what's most common is what's pain with penetration, or any sort of like spasm, block, a lack of entry. And this can be because the pelvic floor is just constantly living in a hypertonic state and it's very tight and tense. So it just feels like really difficult for penetration to happen. It's really sensitive, it's painful. All of those things can happen too. You might not be living chronically in a hypertonicity state, but then when you are intimate or in the bedroom, the pelvic floor seizes up. So it could be more environmental, it could be relational, it could be moment to moment, it could be partner to partner. And so there are also elements that we look at outside the pelvic floor of like the safety in the relationship and the safety in the environment. And those things can play a factor too, because it can be partner to partner specific as well. Other things that can happen is birth injury, right? So there could be whether it is endometriosis or interstitial cystitis, which are more pelvic conditions, or things like birth injuries, second degree tears, third or fourth degree tears at birth itself. Maybe you had an episiotomy or forceps delivery. Maybe you had a C-section. There's more muscle restriction, there's more tissue restriction. The tissue itself at the perineum isn't as pliable and ability has the ability to open and release because there's some sort of injury, scar tissue, or tissue restriction in that area that's causing more friction or discomfort or hypersensitivity in that region too.
Okay, yeah. Again, like makes complete sense, and I just begin to see how much of a wide range of different causes or symptoms, or even yeah, I guess pictures it could be. I don't know if you've heard of the book "Come as You Are," I think by
Mm. Yeah,
Emily.
that's a great book.
Yeah, yeah, I love that book because number one, it gets you to explore your own like pelvic floor, not just, but also like your own pleasure and lust, and just in general, like learning how to have an orgasm if you've never had an orgasm, or like just in general, your own sexuality, really. And I think it normalizes that more, quote unquote, normalized, because one of the things that she's saying in that book is that how different each and every one of our bodies are. Like, even if we think, okay, this is what a vagina looks like, or what a vagina, quote unquote, should look like, there are many, many different variabilities to that. And so thinking that, oh, there's something wrong with me, or I'm 50 and I've never had an orgasm, there is something wrong with me, it's never ever happening for me. And I think that book, like reading that, was super, yeah, I think super interesting for me, in the sense of everyone should just get curious about their own body more and exploring more, and not settling for this is how it is for me, or there is something wrong with me.
Oh my gosh, yeah. I'm so glad that you said that and brought that book up. There needs to be way more conversations around reducing shame around this too, which actually causes pelvic floor dysfunction, right? When we are guarded and tight and tense and we're shameful and we're holding that area. We think about the pelvis as like the sacral plexus, and this is where we find safety. And so if we're not safe in our own bodies, partner or not included, then there is going to be some sort of misalignments that's presented as well. And just one other resource for people that I came across recently in the last 6 months to a year, I would say, is this website called OMG Yes. And it is like a sexual education platform and resource that is, safe and secure, but it is women really putting themselves out there and really trying to help educate the more of the population, women specifically, to be able to like tap into that piece of their life as well.
Oh, super cool. Well, I'm going to make sure to link that in the show notes so people can go and check that out as well. And one of the things you mentioned beforehand was also sort of issues arising from giving birth, or just being pregnant in general. So I know you also work with people in terms of birth prep and postpartum. Maybe you can tell us a little bit about what to look out for during those times, and what specifically your work entails at that stage.
Yeah, absolutely. We always want to work with people sooner than later, right? So people tend to think, oh, I'll just wait until postpartum once the baby's here, and then I'll do all of my rehab and strengthening. And honestly, like the literature and our results and what we're finding is the best outcomes, not only for the birth process itself, but also postpartum recovery actually gets getting you started in pregnancy around the second trimester, middle of second trimester. We're able to really identify, are there any current limitations, are any current pain points or dysfunctions present? If so, we want to start working on those in pregnancy because you can still absolutely see changes, whether that's pubic pain or leakage or pelvic organ prolapse, heaviness, pain with intimacy in pregnancy. You can get started in pregnancy. So that would be like my best advice is if you are pregnant and you are dealing with low back pain or pubic pain or any of these other dysfunctions that we talked about, the best time to reach out and get support is in pregnancy when you notice the symptoms. And then even just like general population, maybe you don't have any dysfunction present currently. Maybe it's your first time giving birth or your second time and you're kind of cruising through pregnancy and you don't notice any big alarming symptoms. That's great. Let's keep it that way, right? So we really focus on birth prep towards the end of pregnancy, which is all about pelvic opening, really getting connected to the pelvic floor for the release and lengthening that needs to happen for a vaginal birth, or any education that needs to happen for a planned cesarean birth, too. This is one of the most biggest and most widely surgical operations that's done with little to no prehab and rehab. It's pretty astronomical if you think about it. And so we really want to get with moms in pregnancy, not to mention after you have your baby, like you are in la la land, you are busy and you're kind of working through having multiple kids or feeding and you're just tired. And that's not the time to find support because like one more thing on your mental load list and one more thing for you to do to find a, qualified provider that you resonate and trust with and have to go to the doctor for, it's just like so much added on to you and to your postpartum journey. So if at the very least, like we have some clients that onboard with us like 3 weeks before they have their baby, just because they want to establish rapport, they want to do some final birth prep, mobility stuff, pelvic opening things. They want to talk about, what early acute rehab looks like right after they have their baby. And so I think that's another common myth of we just can't do anything those first 6 weeks after you have a baby, and then you have a 10-minute checkup that like clears you to do anything. It's just kind of odd when we think about it. And so really there are things you can do, even if it's just 5, 10 minutes in your bed those first couple weeks, and then just slowly progress from there. Early acute rehab actually does result in better postpartum outcomes and reducing pelvic floor dysfunction. So yeah, there's so much that you can do in pregnancy, right before pregnancy for birth prep, and early postpartum. And then from there, obviously, if you have any pelvic floor core related conditions. I think everyone should be doing pelvic floor and core rehab after having a baby. It should be a standard for everyone, even if you're not dealing with issues. But if you are, that's really the best time to get serious about it sooner rather than later for quicker outcomes.
Awesome. And yeah, let's get even more specific. I mean, that was already very well, very helpful. But okay, again, like going to our audience here who's probably lifting, and they want to make sure they keep active as long as healthily possible throughout their pregnancy. What are some sort of modifications that they probably have to do pre-pregnancy, and then also post-pregnancy when they're cleared and so on? And what should they look out for in order not to create, I always say that word wrong, but diastasis
Diastasis.
recti?
Yeah.
Yes. So like, what can we do there?
Yeah, so what the literature shows is that nearly 100% of people at the end of third trimester in pregnancy will have some form of diastasis. So it really isn't as much about preventing diastasis as it is actually continuing to keep the abdomen strong and continuing to keep the linea alba and the core strong throughout pregnancy so that we can reduce as much of the widening and the gap as possible. So with diastasis, if your audience isn't familiar, it's the thinning and widening and weakening of the linea alba, that connective tissue that runs down the midline of your abdomen. It will separate, it will thin, it will widen, and it will weaken just because you're growing a human and the baby has to go somewhere, and it's totally physiologically normal for the body to be able to create that space. But it doesn't mean that we don't want to continue to keep your core strong. So what we tend to do is make modifications throughout, end of second trimester and third trimester, where we're really being mindful of the abdomen and the midline to make sure that there's no coning or doming or tenting, as some people call it, where it's like a bulging sensation at the midline. So instead of, doing planks, we might have you be on your hands and knees and doing breathwork activation to still activate the core. And we can still make it challenging. You can still, lift an arm and a leg and do dead bugs or quadruped extensions. Like you can still do half kneeling rotation. And there's still so many things that we can do to keep the core strong. And we actually do want to keep activating the core. So it's not like you just stop doing it. It's just modifying the positions that you're in so that you're not, you no longer doing, barbell leg raises with a third trimester baby, and you're just modifying your core exercises and workouts. The goal and intent is to reduce as much of the widening as possible and keep the abdomen as strong as possible so that when you roll into postpartum, what the research shows is about 50% of people will have resolved diastasis, or at least it will come back together enough about 6 to 8 weeks postpartum. But the other group of people will need to like really actively work on it too. So assessing yourself in postpartum can be really helpful too, to know where you stand and where you're at. So we say anything under than like 2 finger width if you're testing it, and I have a guide somewhere on my Instagram account. If you just like DM me the word diastasis on my Instagram, you can get a whole video tutorial because I instead of like walking through it now. But I will say that, being able to identify and recognize, oh, I am having some bulging here. Maybe I need to make some modifications. And then into postpartum, just really gently moving in from gravity eliminated, back line, sideline, hands and knees, and then half kneeling, and then standing. So just really progressing your body in a safe way back to return to strength training too.
So that makes a lot of sense. And thank you so much for that offer or invitation to send you a message as well. Obviously, as I've said, I will link your account because you provide so much valuable information on your Instagram as well. So thank you for that. And I know you also work with a lot of people on toilet, whether it is basically preventing leakage or, if someone at post-birth is experiencing a lot of leakage, but also things like passing stool more easily or so. So, what does that work entail, or what are some common things? Because someone might be listening and like, but I thought that is normal. I don't actually need to see a pelvic floor PT for that. So, what sort of things do you work with?
Yeah, public health is a big umbrella, right? So there is a lot of things that we do. And really, like you mentioned, 50% of it is education. And then the other 50% is training. So a lot of the education is not only like, let's get you acquainted what the pelvic floor is, but also it could be toileting strategies. It could be pressure dynamic. It could be postural. It could be how the rib cage is correlating connected to the pelvic floor and why that's causing some dysfunction for you. So really, about 50% of pelvic health stuff really is education that we're doing with our clients one-on-one, and then the other half is training. Some odd things that people didn't really know that there's correlation or connection to with pelvic floor is like endometriosis. This is definitely where a pelvic health provider can work with you one-on-one for any period pain or pelvic pain that you might be experiencing. Interstitial cystitis is another one, or if there's any frequency in your urine where you're rushing to the bathroom. These are often like signs and symptoms where people maybe think it's normal and they don't really realize who they should go to. Or I didn't have a baby, but I wasn't ever pregnant, so I shouldn't have issues with leakage. It's like you can definitely still work with a pelvic floor therapist and specialist in that. Other things like you mentioned too is constipation. So difficulty passing stool or having that bulging or heaviness sensation while you're toileting for bladder or bowel output can also be an indication where you need more guidance and education around different positions or different strategies to reduce the load or the pressure tolerance on your pelvic floor as well.
Okay, yeah, I think that's really interesting, and especially because everyone's anatomy is different. So, like, you might have kind of a kink in your digestive tract, and that alone makes it difficult to pass stool or so. So, simply by taking in a different position potentially, or adding one of these, what are they called? The potty stools, or no, the body.
Body potty.
Yeah, that one.
Yeah.
That in and of itself might be a quote unquote easy solution or so. So yeah, I think that that's really, really interesting. And I think I've shared this before on here also. I always thought like I have a really good, strong pelvic floor. And then when I started CrossFit, or when I was doing CrossFit many years ago, I was trying to do double unders, so like double jump roping. And every single time there was leakage. And then there was one day was a competition. Like most of the time, I would be like, okay, we're just practicing 5 minutes. I can feel I have a little puddle going on there, but it's not super obvious. And I was just a little bit embarrassed, but it wasn't anything major. One day there was a competition. It was like literally like, I don't know how many double unders, but a lot. And I'm
Mm,
very competitive, so I didn't want to stop in between. But I finished the set, and I kid you not, it was a proper puddle beneath me. And
yeah.
yeah, I was fortunate that there were other ladies that were like mopping the floor after me, but I was super, super embarrassed. And I know that there are many other women that struggle with like jump roping or box jumps or whatever. And I just thought like, what the heck is going on? And now I know that I had an overactive pelvic floor, but just
Hmm.
knowing that, hey, no matter what state you're in, even if you haven't had any kids, even if you you are a man and you have pelvic floor issues, it's not just for women, as you were saying. I think it is so important to reach out and get the help, or just to simply even speaking to someone about it. So maybe now, like to sort of round off with, what are some pelvic floor issues a man might experience?
Yeah, so I just full transparency, I don't specialize in males, but I will say, yeah, they can still experience incontinence. They can still experience constipation. Prostate health is really closely interconnected into that area. Difficulty achieving an erection, that can absolutely be, or not being able to hold an erection for a long period of time either. That can absolutely be a pelvic floor weakness or discoordination issue as well. So there are pelvic floor specialists that only work with men or that really specialize working with men. And there's some pediatric pelvic floor therapists that really specialize in working with kiddos and potty training and potty learning and any, bedwetting later in their ages or developmental delays and working with children in those aspects too. So that's what's so amazing about the pelvic health field is there are literally specialists that work in every department. So it is not just related to only one particular group.
Well, I love hearing that. I love hearing that the help is available. And to the point of help, I would love for you to talk a little bit about what you offer. Is it purely one-on-one? People come and see you at your clinic? Do you do one-on-one online? Do you have any group program or something that people can take on their own? What kind of things do you offer?
Yeah, thank you. So here at your postpartum PT, we work one-on-one with women specifically, and mothers that are in the preconception stages where they've never conceived and they never had a baby, but they're dealing with pelvic floor issues and they really want to work with women who get it. We are those people. We also specialize in pregnancy, postpartum, and return to strength training. So really, pregnancy keeping you strong, avoiding and reversing pelvic floor dysfunction in birth, helping you prep for birth and have a smooth labor with as much limited injury as possible, and then transition into early postpartum and beyond. And getting you back up to strength training, which is kind of another gap. It's a secondary gap. There's the initial gap of just getting people in pelvic floor and care support, but there's another gap of knowledge of pelvic floor providers not really understanding or knowing how to swing both sides, where they might be great at their basic rehab stuff, but they really don't know and how to understand how to get someone to stop leaking with double unders at CrossFit or with heavier weightlifting. And so that's where we specialize as well as being more of that hybrid approach between pelvic floor rehab. All of our coaches are, clinicians, doctors of physical therapy, have their masters in pelvic health, but then also in addition are strength training coaches and stress, anxiety, mindset coaches. And so really working on habit, behavior, education elements too. So we work with clients 100% online, and majority of the time we are resolving pelvic floor conditions in just 3 to 6 months, working with you
Wow.
one-on-one. Mm-hmm.
Super cool. Well, I love it. That sounds amazing. And I love how you bring on or brought on experts for various fields as well. Um, Nonetheless, let's say someone cannot afford or doesn't want to spend the money on one-on-one coaching, and they don't have any per se hyper or hypoactive pelvic floor issues. And so they've just given birth and they want to get back into strength training. Can you give us, I don't know, 3 to 5 exercises that they can do to slowly get back into proper lifting?
Yeah, absolutely. And we have a free community too that has like a free pelvic floor mini course, if you will, and like 7 days of exercises. I'll give you that link too so that you can share it. So we'll make sure to get that over to you for people that are maybe struggling with that affordability piece. So that we'll have that for you. But then also I would say to get started is just start getting connected again, kind of like we talked about. This can be through breath work, right? This is not strategic breath work. Breath work doesn't always mean contraction and activation. Breathwork can just be started by, feeling the expansion in your rib cage 360 degrees and allowing that pressure to transfer down to the pelvic bowl and to the pelvic floor and allowing you to send that to the front part of your pelvic floor and the back part of your pelvic floor. So just getting really practice with being able to take that breath in. You get good rib cage mobility and then sending that down to get good elongation and lengthening of the pelvic floor. And then from there, you can progress it, right? So then it's like once we have length, then we can start focusing on contraction. And then from there, we want to work the whole body. We don't want to just do Kegels and focus on pelvic floor contractions only. We want to get your glutes strong. So you can start off like with just simple bridge exercises on your back, or it could be from fire hydrants on your hands and knees, sideline leg raises. So this is like if you're very early on in the stages of just getting back into postpartum recovery and starting to the strength training piece. But we also want to work on the adductor muscles, those inner thigh muscles, really building up endurance in those muscles as well. So this can just be squeezing a Pilates ball between your knees and holding on the exhale all the way up to like Copenhagen, right? So we can get really challenging with these exercises, but focusing on glute strength, hip strength, adductor strength, rib cage mobility, low back mobility, and just making sure that we're not missing the whole body approach.
Awesome. Thank you so, so much, Jessica. I'm excited to put that link to your community in the show notes as well as everything else that we spoke about. And I'm just super, super grateful for your time today, but even more so for all the wonderful work that you do with individuals worldwide.
Yeah, absolutely. And thanks for having me on and being willing to have these discussions. They're so important. And the more that we share stories and education, the more that we reduce shame and embarrassment and frustration. So we give people answers when we have these conversations. So thanks for opening the door for it.
My absolute pleasure.